Hello, everyone. I'm Dr. Rose Nakasi, a computer scientist by profession and a lecturer at the Makerere University. I also do lead the Makerere Artificial Intelligence Health Lab here at Makerere University. I'm going to be talking about our Ocular Project, which is on improving microscopy disease diagnosis in resource-limited settings. Now, one of the challenges that we face in sub-Saharan Africa with diseases such as malaria, cancer, and tuberculosis, which are some of the major public health concerns, especially in our context, is that we do lack enough trained experts to support the diagnosis of such diseases. Diseases such as malaria are diagnosed through modalities such as the microscopy, which is actually the gold standard mechanism for disease diagnosis. But across Uganda and many other sub-Saharan Africa countries, they face delays in the way these diseases are diagnosed. It's not because they lack treatments, but because of basic diagnostic tools that are out of reach. And this is attributed to the lack of enough skilled experts. For example, in Uganda, if you to look at the ratio of lab technicians vis-a-vis patient ratio in Uganda, which is actually standing at 1 to 16,000, you'd realize that there is a very big lack of experts, especially in Uganda, and not only in Uganda, but in similar contexts. We know also the other challenges that are associated with microscopy is that it usually is slow. It is tiring and prone to error. And this is because the expert has to strain their eye to look out for those pathogens, especially malaria pathogens that are very small, using their eye through the eyepiece of the microscope. So what that does is that if they are to screen so many patients, there is going to be a very big strain onto the eye, but also the process in its own self is very tiring. And that's why, according to the WHO standards, they require experts not to screen more than 30 patients in a day. But what that leaves, especially in very high endemic settings, disease endemic settings, is that most of the patients, if we are to go by the WHO standards, is that most of the patients are either not going to have gold standard diagnostics, or they have to wait longer until they get this kind of diagnosis. And that means that for diseases such as cancer, by the time probably they get an accurate diagnosis, the disease would have gone in states that are very challenging. And this usually leads to mortalities that are caused by misdiagnosis. What is Ocular solution here? So we are proposing that if we have microscopes at most of the public health facilities, a study was carried out in Ghana, which actually proved that we have more microscopes, especially in the public health facilities, than they are experts to use them. So what that means is that if we have at least a microscope at every center, we also have smartphones, even in the most highly endemic settings like Africa. So can we be able to utilize the availability of those equipment, dubbed with emerging technologies such as artificial intelligence to support disease diagnosis? So what we have created under Ocular is that we are leveraging on the existence of the microscope and the smartphone, and we have developed a 3D printable adapter that we connect onto the smartphone, onto the eyepiece of the microscope, to provide that attachment where the smartphone camera syncs with the eyepiece camera to capture whatever is under the microscope onto the smartphone. So what then that does is that it is going to support the microscopist on the other end to, at the comfort of his desk, to be able to capture the image directly the way it is from the microscope onto the screen of the smartphone. So the smartphone is capturing all those images through, and then through computer vision, our tool is able to scan and detect and count all pathogens in real time. Here, we don't need actually high-tech laboratory technicians, or we don't even need Wi-Fi it is able to work at the point of care, because once the expert captures the smartphone, the artificial intelligence model running in the background is able to characterize the pathogens and then bring inference onto the smartphone. So the diagnosis is seamlessly received onto the screen of the smartphone. We started off this project with malaria, but are scaling it to different other microscopy disease challenges, such as cervical cancer, such as tuberculosis. And how the application really works is that we have worked with experts in Mulago Hospital here in Uganda and other hospitals across the country to curate a good number of images. They are supporting us in characterizing the pathogens of interest. If it's for malaria parasites, if it's for tuberculosis bacilli, they are supporting us to annotate that data. And then we utilize different machine learning models to understand the features of the objects of interest, which could be parasites, which could be bacilli, which could be any malignant case for cancer. So here you can easily see that the artificial intelligence model that has been trained across so many images has been able to learn the characterizations of the malaria parasite and is able now to bring inference onto the image, directly supporting the annotation of these parasites onto the blood slide image, so that the expert is able to just look at what the model has done and then provide a final confirmation of the results. Against project progress, we've been able to achieve malaria diagnosis classification model of accuracy of up to 0.99. And for cervical cancer, we've reached 94% of accuracy. And what that promises is that we are able to have an inference that is almost relatable to the expert knowledge. We are doing different solutions across the different modalities of diagnosis that we are looking at. For malaria, we're not just looking at detecting parasites. We are looking at characterizing species. We are looking at quantifying parasitemia. We are looking at detecting different life stages of the malaria. For tuberculosis, we are looking at identifying tuberculosis bacilli. For cervical cancer, we're looking at being able to characterize the different malignancies on the histopathology images. For the model efficiency, we've made this inference not only run onto the laptop, but we're also providing local platforms on the mobile phone, so that once the image is captured on the mobile phone, it is able in real time to provide a diagnosis. And this literally takes 5 seconds to process a field of view for malaria parasite detection. Just opposing that with the time that the experts have been taking, which is more than 30 minutes to give a diagnosis, we are seeing Ocular providing that efficiency in terms of the time, but also in terms of the accuracy in the diagnosis. So this is going to support the clinicians, the lab technologists at the points of care to provide quick and more reliable diagnosis to the patients. We have trained over 150 lab technicians across different health facilities in Uganda to utilize the Ocular solution. And across pathology units, we have now collaborations with over 10 pathologists who have been trained to utilize, again, the Ocular solution at their points of care. So the future of Ocular is actually more than just diagnostics. We are looking at it as a platform that is going to support smarter health, because we are not just doing disease detection, we are also looking into aspects of supporting real-time disease surveillance, and also providing teaching aids that could actually support building capacity for health care workers more efficiently, especially the students that are taking up lab technologies. We are also looking at Ocular using natural language processing to translate the insights that have been provided through the ocular solution, making these results very understandable to everyone, especially the patients who would actually want to understand their results or whatever outcomes of the diagnosis in languages that they can be able to relate with. So again, we are utilizing artificial intelligence to support health communication with technologies such as natural language processing. Join us in scaling artificial intelligence for health equity. So we are looking at expanding this work, and we are looking forward to partnerships to make scaling possible. We are looking forward to working together to scale this project to achieve a reliable disease diagnostics, and this is to provide social good in the communities where we come from. So in terms of scaling, we are looking at all disease endemic settings, especially in the sub-Saharan Africa, but also we're looking at scaling in terms of expanding this work to other disease challenges that are microscopically diagnosed. Thank you very much.